This technology is going to completely change how the healthcare system works, fundamentally. I'm Harry Schrabe. I'm founder and CEO of Newton's Tree. So Newton's Tree is an AI deployment and monitoring platform. So it's a computer system that sits within the hospital, and it allows the hospital to download AI applications, and it integrates them with the rest of the hospital, keeping them safe.
Hi, I'm Professor Andy Scarsbrook. I'm a clinical radiologist based in Leeds and work at the university as well, active in healthcare-related AI research. I mean, there's been an awful lot of hype around AI and, some leading protagonists pronouncing that it's going to replace people's jobs, particularly in the healthcare field. And largely they've been proven to be quite way off the mark. So it's dealing with that sort of fallout of hyperbole and looking at the sort of practical implications.
The core principle at present is that the AI solutions are providing information to support clinical decision making, which is ultimately about safety and knowing that a clinician is still making a decision for them. It's the best decision for them.
What that will look like as a service user, as a patient, I think is going to be almost unrecognizable. Medicine used to be a botanical science, right? You had to understand the properties of like plants and leaves, and then it became a biochemical science. And eventually, medicine is going to become an information science. But throughout all of those revolutions, we've always called them doctor.
So the core problem around about AI deployment is about demonstration of safety and the transparency about its use. And therefore, how do we do that within busy hospital systems with clinicians, be it radiologists, ED doctors, wanting to be able to know that the performance of the AI is continuing and how it's impacting on their care and be able to create that feedback loop. And I think that's key around about transparent use and how we can optimize its use and understand how we can get better value from the deployment of these systems. But at its core is demonstration of safety.
I was actually genuinely surprised as once the platform was deployed, which was the same as a typical deployment, but once it was there, we could deploy multiple AI applications very fast onto that platform.
So Newton's Tree's approach has been really useful because it's been collaborative, and I think that's the key of it. It's bringing together data scientists, researchers, the clinicians on the ground, radiologists, the downstream respiratory clinician, ED doctor, and be able to understand what the problem is, supports their use of the AI tool, makes them feel confident about its safety, but also allows them to think about how we can continue to refine how the solution is used to optimize the care for patients.
So what's really exciting is that every day, hundreds of patient scans and patient data flow through the Newton's Tree platform in NHS hospitals, and we're able to inject AI intelligence at the point of care in real time. And that allows doctors to make decisions waiting only minutes rather than days for the answer.
So I think this can bring the ability to be much more efficient in what we do and make better use of limited resources.
I think that in the NHS, we know that we need to improve our delivery of care so the right patients access the right care at the right time. A particular example is thinking about our chest X-ray prioritization study, where we were able to use an AI solution to look for early detection of lung cancer and expedite by a number of weeks their surgery and implementation of oncology treatment. And I absolutely believe if we adopt that at scale throughout the health service, that we will be able to detect lung cancer earlier and save more lives.
So my name's Mark Phillips. I'm the Chief Clinical Officer at Harrison AI. We're working with Newton's Tree on the FAMOS study to demonstrate what's possible. So we are the manufacturer of the chest X-ray and head CT product that is used on Newton's Tree. So the way that works is the patient presents for a normal chest x-ray, normal head CT. The normal imaging is acquired. It's come into our AI model, it's been processed, and those results have been returned back to the healthcare system. What that means for the radiographer who may be acquiring the image, or the reporter who is interpreting the image, our AI results are available effectively as soon as they open that image. If I think back to my initial conversations with Harris, it was largely around the question of how do you monitor drift?
Population drift, where the population drifts away from the AI model. Automation bias is another one. So we were looking for means of quality assuring that within an application. And the FAMOS Project was an opportunity to explore whether that was achievable within a single platform.
If things are moving slowly over time, how do you actually start monitoring them in relatively small time windows that allows that ability to say, this is something that is meaningfully changing, even though it's a very series of subtle and small changes. These types of platforms that are assessing model performance in the real world become an essential part of that post-market surveillance and that ongoing monitoring of the safety and effectiveness of our products.
So the impact that Newton's Tree's had is really around about confidence to proceed. And that's confidence to be able to move from deploying some of these AI tools within research, often in silico, so not actually using them to influence care, to be able to say there's a scalable platform that we can actually go out to our clinical colleagues and say, here are the checks and balances, the audit tools that are going to allow us to use this real time to influence care. And that's been really important as we start to be able to think about scale up of these solutions and be able to, for instance, interpret every single chest x-ray that's been done, which is over 100,000 a year in the Queen Elizabeth site.
And as a clinical academic, I can see, very closely how this could have a great benefit to patients.
I started my career in the National Health Service, and ultimately what I want for Newton's Tree is for us to work with health systems all across the world to serve people, patients and the public, and maybe to solve some interesting problems on the way.